I'm Dr. Vonda Wright. I'll introduce you to myself so you know what we're going to talk about today. Today we're going to be talking about what I call peak performance and precision longevity, how to move from midlife misery. Some of you don't look like you're in midlife, but if you are, you may have experienced what I experienced. From midlife misery to mastery, because this time of life from 35 to 70 does not have to be associated with all the things we're hearing now in the popular press. And thank God we're talking about midlife, because I'm going to reflect for you. When I started talking about aging in 2004, nobody wanted to talk about it with me. I was alone standing on a mountaintop screaming that this can be amazing, and nobody wanted to listen. So I'm so thrilled now that everybody wants to listen. Well, I am an orthopedic surgeon. I have been a practicing, seeing patients every day. I did this morning, orthopedic sports surgeon since 1990. And in that role, I get to take care of amazing people. You know, my youngest patients are around 11. My oldest has been 100. And so we harness the power of mobility to change people's lives. And I have a clear bias on what I think the primary tool for changing lives is. I don't know if any of you have reached this yet, but I woke up in the middle of the night with crushing chest pain and a beating heart, and I thought I was having a heart attack. And my dad had had a series of heart attacks, and I thought, oh my God, I'm only 47. And at the same time, I was enraged all the time. I could not be angrier for no frigging reason, right? I had one of the best sports jobs in the world. I was the medical director of the UPMC Lemieux Sports Complex, and I could not wait to get out of there because I was enraged all the time. And I didn't know why. Because even though I was an orthopedic sports surgeon with 22 years of formal education, nobody had taught me what was going to come in midlife. I seriously wondered, will my health last? There's a myth in this country that there's some certain hallmark birthday when we're going to slow down. I'm going to tell you what the science says. What is actually happening in this country around us? Maybe not in this room, but around us. This is what's happening. Since the turn of the 1900s, when the life expectancy was 40. Now listen, the life expectancy of men was 40. We don't know what the life expectancy of women was because nobody bothered to take the data, but men were living to 40. The life expectancy today is 79. But what is the health span expectancy, right? To you, this is not a new term. For most of the population, this is a brand new term. The 33 chronic diseases that kill us in this country that are collectively called sedentary death syndrome, whether you are diagnosed with them younger in age or whether you're diagnosed with them in your 60s, manifest their ugly heads at 62 on average. So if we are living almost 80 years and we're going along fine, I'm fine in my 20s and 30s, I'm fine moving into middle life, and then our health span runs out and we spend 3 days a week in some doctor's office managing one disease at a time. What are we doing for 20 years, right? My goal with what I do for my own patients and clients is to equalize the health span and the lifespan and help you be healthy, vital, active, joyful 1,440 minutes a day, right? That's my goal. I know it's unrealistic, but okay, let's talk about some of my research. Am I just a Pollyanna? Am I just really excited? I want to show you the science. So I study master's age athletes. You have to be 40 to get into one of my studies. I don't care how old you get. 103 is the oldest person I've ever studied, because these people maintain high levels of functional capacity throughout their entire lifespans, right? When you read most medical studies that are population studies, what are you reading? You are reading data from cohorts of sedentary people. So the data that comes out does not tell you what we're capable of if we invest every day in our mobility. It tells you what will happen if you sit around like 70% of our population does. I never believed that we are destined to go from the vitality of youth down a slippery slope to frailty and despair. No, I knew that was because data was gathered on sedentary people. So what does it show us when we study only active people? Well, frankly, I could go on and on. These are pictures of a lot of our studies. I am not going to do that to you today. Here's the wonderful thing. That's what this conference is all about. We are no longer living like we have lived for the last 150 years of modern medicine in a watch and modify way. We are no longer destined to use the research from a single cohort in a research study. Usually, because research is expensive, a cohort of people we study is usually a group of 40-year-old white men. And then we apply that data to every gender and every race. We are no longer confined to that because now we are living in the time of precision and prevention because we have sequenced the genome and we can be precise. So that's why this is so exciting. But I also want to show you something special. I use 3 pillars. I've already introduced this to you. Molecular science of aging. I do measure some biomarkers. I don't measure all 8,000 biomarkers that I can measure on you because I've been a clinician for 25 years. And I'm going to tell you, people get confused. So I usually start with 4 or 5 things. In fact, I just had a couple come down from New York and I spent 2 solid days with them. And I only gave them 4 things to do. And it was still a lot. So when you're working with people or you're working with yourself, give yourself some grace. You can only do a few things at a time and do it well. So I start with the molecular science of aging with biomarkers. I'm going to show you the ones I use. We do precision testing to prescribe your lifestyle habits. And then we use 2 methods for mindset mobilization because I believe that the mindset we take into aging predicts our future of aging, how we believe we're going to age. So here are the set of biomarkers I use. I've added clothos to this, but they really fall within 6 categories. I am not trying to measure everything. I am trying to measure the actionable biomarkers with which I can help people. And there's lots of interesting ones on there. When we are young, our intracellular NAD levels are up between 40 and 60. That's why we have a lot of energy bouncing off the walls, right? But what happens as we age? We just are not as energetically efficient. So we talked about molecular aging. We talked about precision longevity. My approach to precision longevity and going from midlife misery, where we think we're out of control, to midlife mastery is not rocket science, but it is 4 things done in a precision way, using the principles of molecular science of aging, precision lifestyle, and mindset mobilization. Because it has worked for me as one simple example, and it has worked for all my real life people that join me in Lake Nona from around the country, because I believe using these simple tools, you can be healthy, vital, active, joyful, long into this foreseeable future. So thanks for letting me come to this conference.